Good morning, good afternoon, and good evening to everyone. My name is Dr. Maria Nnambalirwa. I'm a Senior Clinical Advisor with the ASPIRE project at the Elizabeth Glaser Pediatric AIDS Foundation in Eswatini. The title of my presentation is Using a Universal PrEP Provision Approach in Pre- and Postnatal Care Services Increases Uptake of PrEP Among Pregnant and Breastfeeding Women in Eswatini. First of all, a brief introduction to the Elizabeth Glaser Pediatric AIDS Foundation. This is an international organization formed out of a mother's love for her children. ECPAF has been in Eswatini since 2003. It is mainly funded by PEPFAR, and its initial focus in the country was on PMTCT. As a background, HIV incidence among pregnant and breastfeeding women in Eswatini is estimated at 4.2 per 100 person years, and maternal seroconversion remains a major contributor to mother-to-child HIV transmission in Eswatini. HIV prevention, including PrEP, is thus a key intervention in elimination of mother-to-child transmission. Daily oral PrEP has been shown to be very effective in reducing HIV acquisition and is also safe among pregnant and breastfeeding women. Eswatini has been scaling up PrEP since mid-2019, with pregnant and breastfeeding women as a priority group. ECPAF Eswatini has supported PrEP scale-up in 63 facilities, including within PMTCT services, and in late 2020, universal PrEP provision using an opt-out approach was recommended as part of the National Elimination of Mother-to-Child Transmission Strategy. The provider-initiated approach is the opposite of the standard risk-based strategy and involves PrEP education and PrEP being provided regardless of whether the client has requested or not. PrEP is provided routinely for all HIV-negative pregnant and breastfeeding women, together with all other services. PrEP is only withheld in case of clinical contraindications or pregnant and breastfeeding women refusing to take PrEP. ECPAF began implementing this approach through training and mentorship of MNCH staff to increase PrEP access among HIV-negative pregnant and breastfeeding women. Descriptive data was used to compare PrEP initiations during early and late implementation phases of the Universal PrEP policy, and these were January to March 2021 and July to September 2021, respectively. So these are our results. And you can see in this column that we have the results for the early implementation period as well as the late implementation period in the other column. So the pregnant and breastfeeding women already on PrEP in the early implementation period were 183 over 3,358 or 5%, and this increased in the late implementation period to 760 over 4,344 or 17%. PrEP initiations among the remaining women not on PrEP were 671 over 3,175 or 21% in the early implementation period, and this increased slightly to 821 over 3,584 in the late implementation period, which was 23%. So out of the 671 women initiated on PrEP in the early implementation period, 523 or 78% were actually pregnant, and 148 or 22% were breastfeeding. Similarly, in the late implementation period, 79% of the 821 were pregnant, and 21% of the 821 were breastfeeding. Of note, the pregnant and breastfeeding women's contribution to new PrEP initiations rose exponentially from 60% or 671 over 1,110 to 73% in the late implementation period, or 821 over 1,115. So from the results, we can see that universal PrEP offer is not always routinely implemented for all HIV-negative pregnant and breastfeeding women, and many women offered PrEP chose to opt out. We plan to reduce missed opportunities for HIV prevention in pregnant and breastfeeding women through a greater focus on mentoring staff to reinforce the opt-out universal provision approach, through tailored HIV risk and prevention messages for pregnant and breastfeeding women and their partners, and through adapting M&E tools to enable improved documentation of PrEP offer and acceptance, and also to enable faster identification and monitoring of HIV-negative pregnant and breastfeeding women not on PrEP. In conclusion, when implemented to scale, routine universal provision of PrEP within PMTCT services can be effective in increasing uptake among HIV-negative pregnant and breastfeeding women. I'd like to acknowledge the support of the Ministry of Health in Eswatini, USAID PEPFAR, and the Elizabeth Glaser Pediatric AIDS Foundation. Thank you.